Hello and welcome to this week's program. My name is Sharon Wangui. We are joined by a psychologist. I will allow him to introduce himself in a few. This program is brought to you by Search for Common Ground Kenya and funded by the European Union. Please introduce yourself.
Hello, my name is Ismael Michael. I am a psychologist currently attached to the Koni sub-county.
So when COVID came, it came with all kinds of troubles. And I think one angle to it is the mental health kind of angle where we haven't had really time to talk about it. And I think it's important for people to actually talk about it. And you're in the front line. People like you are in the front line when it comes to matters health issues. So mental health issues. So what has been your experience with, people who are positive and negative, but are just traumatized?
Okay. Thank you very much for this opportunity. So, any pandemic, anything comes with the trauma, and it comes with a lot of destruction in the daily life, the way things are being done. And COVID-19 is nothing, it's still the same as anything else. So it was expected, though people did not really anticipate that the most affected aspect of people's life will be the mental aspect. And you get that the very first time and the very first case we had in Kenya, that was in around March towards April, and people were like, okay, no, this is real. We're getting scared. But then everybody else were like, it's not going to come to Africa.
It's not in Africa.
Yeah, we are immune. We've got,
I mean, we're black.
we are strong. So when it came, and I remember the very first two people, when they had finished their isolation program and they came out to the television, there was a lot of things which were going on. And then the lockdown was effected because everybody never really thought that the lockdown could be effected. And then we started in very particular areas in Kenya, not everywhere else. And then the cases were still rising. So when the lockdown came in and everybody were like, 1 week, 2 weeks, it will go away. It's a holiday which we've been looking for. Then the kids are going to school.
Well-deserved holiday.
Yes. And then it happens that everybody was at home. And then the husband and the wife were forced to now sit and face the problems that they had. And then the children, especially those who were in boarding school and they never really got to spend time with the parents,
now
yes, they will have to spend. And this was on top of those people who will get tested. And you remember that at some level, tests were done for the people who were coming outside the country. So we had not started testing within the ground. And then there were hotspot areas, so that tested was supposed to go there. I remember one of the hotspot area in Mombasa County was Kibokoni. And I remember by that time, the governor and in conjunction with MP Mvita had created a community mass testing in Makadara ground. So people didn't want to go there, because then again the lockdown was affected and everybody was like, what if I get COVID? And it was surrounded with a lot of uncertainty. People didn't know what this is all about. So you find that there was a lot of anxiety on top of what we were supposed to see. Children were at home, disturbances. Then the people who at first it was few holidays, few weeks. And then it came to be now that some people were laid off, that the company could not anticipate that. So there were issues to do with finances and households, specifically household finances. And then there are those people who were living from hand to mouth, and it came at the time people need their rent, like the landlord needed their rent, they needed to eat. Sometimes because of the lockdown, there were no movement at all. And so people really got worried. So anxiety, I would say, and stresses level were part of it. Then eventually, while you were having children at home, especially the teenagers and the young adolescent, they're born to act out their aggressions, their excess energy. And you've got now cases of gender-based violence. This includes the sexual part, the emotional gender-based violence, the physical gender-based violence. So they were now on the rise. And I remember once in September, August, there were cases of teenage girls who were pregnant. So even those who had gotten pregnant before the pandemic, those who had gotten pregnant then, they all combined together and all became a crisis, and everybody would cry, let the children go back to school. So that's generally that's what you're going to see in a nutshell. So if I was to summarize that, then we will be having, for those people who were positive, we'll be having anxiety. Then we've got stigmatization that was very much, especially the very first time. If a household found people with COVID, then it will have been marked. The children were asked not to play with children from that household. And you remember the very first time, it was the ambulance who were coming, people in full PPEs, and they were donning everything else. So like, and then whatever we were getting from outside, it was that, the pictures, the very first pictures from Wuhan city.
Exactly,
people were just falling in the street. So everybody thought that, okay,
that's about to happen.
That is not COVID. So those are the very few things you're getting, the stresses. Because then there are people who the family member had tested negative, because it was a mandatory. If you tested positive, the contact tracing, in the contact tracing they will test everybody that they have come in line with you. So there are those people who were going to be tested and they were negative, but they needed to be quarantined in the government or the county government designated areas. And the very first time people were paying, that people were scaling out, so people were paying. So people were like, by the time COVID, yes. Like when you get to COVID and you tested positive, you just lie, because then we don't have money to go and pay there. So there were also stresses in terms of finances for both people who were in quarantine and isolated, and by that time it was the government facility before the county government stepped in. And then the other thing which we were facing with mental health, it was now the fear of the unknown and the uncertainty. So that basically you will face when you go to the ground, and the separation from the family. And then you've got, for those people who were not tested positive or those who were negative, and they had not gotten into contact with anybody else. So it was affecting all of us. We could not do our businesses the way they're supposed to. Then there was the curfew which was implemented, and then there was the cessation of movement which was implemented. So there was panic, and even then, so basically with them it was all about panic. What are we going to do next? And then came the finances, and you get a household with teenagers, came the food.
That's really serious.
I'm telling you, they're going through 10 kgs of rice
in a week.
And they could not imagine what that could be. And then they came now with the discontent partners, and I don't mean the HIV part. I mean the people who were not margin. When everybody were going to work, in the evening, everything was on. Now everybody was forced to
24 hours.
So we got to face the violence, especially the physical violence, and the ones which came out before the sexual violence.
So people were venting, I guess,
yes. It was not only about venting, but also we find that these people, already their marriages weren't working.
There were underlying issues.
So they will come out clearly in there. And then came the sexual violence. The wife would be tired. I'm like, okay, take your time. But then they will follow the neighbors' kids, and they will turn against each other. And then came the emotional violence, because now people were getting arrested, so they will hurl insult at them, and to take a toll on the psychological aspect of it. So basically, that's what I will summarize. What mental issues we faced. Then this will trickle down to, because kids were at home most of the time. Substance use get to be frequent, and then you've got now higher mental illnesses, especially severe mental illnesses that people get to see. People could not access services, especially for those who are accessing mental services and mental health services, especially in mental unit, they could not get them. People who were suffering from even long-term diseases like cancer, hypertension, they could not really get it. People who are in HIV treatment and care could not access it. They were given long-term because you remember they fall under the vulnerable group. So they were given long-term medication. So we could not really follow up with them. We don't know if they were taking the medication. We get that we got people with high variolium going up. So generally that's what we're getting. But then these other problems, they came after the first initial shock and whatever that will come out.
So people realize that there's a problem and we have to seek help. So that's when they come to you guys. So how did you handle it? What is the process? How do you handle a person who's approaching you for such services?
People don't know that they have a problem. And that is the concern we are having when it comes to psychological services, especially in sub-Saharan countries.
No one wants to admit it's an actual problem.
It's based on the culture how people are raised to. For you to come and say, I'm having this problem, to even express themselves that
what you're feeling,
yes, it's really a concern. So when it all started, they could not really say that they're panicking. What you could see was just anger reaction, or people jumping from the isolated center or from the quarantine center. So that was a reaction to the psychology manifesting itself, you know. So when they started bringing us in, so you realize that what happened is, especially now, the people who started benefiting from this were people who were coming from outside. There were children who were stuck, university students who were stuck in various situations, especially in the epicenter in Europe, the children who are from Kenya or the young adults who are from Kenya who were stuck in Europe, and their people were actually dying.
It was really serious.
Yes, it was very serious than what they were facing. So when they were coming to us, what happened is we will get them immediately at the airport. We get tested, their fevers and everything else, and then you get psychologists who will come in and they will talk to them. They will sort of debrief them what was happening, where they're coming from, getting their feeling, and then prepare them to where they're going, what is expected of them, how long that you're supposed to get. Remember at that time, we will have patients who are staying even in hospital for more than 2 months. You know, they will still get tested and they will test positive. So just before the guideline came to 14 days, and then the guideline now came to 10 days and rolling the HbA1c. So we will sort of prepare them. So we'll sort of give them psychoeducation, what is expected of them when they are at the center. And you remember that's the time the county government stepped in, like enough, and they were offering the isolation services and the quarantine services for free. That was in Technical University in Mombasa for our case. And then there were different quarantine services depending on the sub-county. So there is one at Kenya Medical Training Campus in Mombasa, the KMTC. Then there was the government one, it was the Kenya School for the Government in Kizingo. And then we've got another one in Likoni, that was Likoni School for the visually impaired. That was a quarantine center. Then we've got one in Portrees, and in Kisauni-Nyali, it was at Otangi Dispensary. Yeah, if I'm not wrong. If I'm not wrong. So those are the various quarantine centers that you're having. But the isolation center was at TUM, Technical University of Mombasa. So we find that we will tell them that these services are free, and they should not really anticipate, you know, that first-class service, because we're all working on the budget. But then they were assured for
it's a
food.
Pandemic, guys.
Yes, they were assured for food, and they were assured for their safety. Basic needs that they're supposed to get, and water. And during Ramadan, there were partners who came in, and the food during Ramadan was really nice. That's something which I can guarantee you before. So basically, that's what was happening. And then we started now rolling out in terms of the services now when we were going to get tested. So we had to go ourselves, go get sensitization training programs, or even higher training program of COVID-19.
Yeah, because I realized you weren't taught about this in school. No one told you.
No one told
this one time there'll be COVID, so you also have to go through the whole process.
Yeah, so we went back to those training sensitization or training programs. So we knew what they were supposed to be looking for, and then we will introduce everybody else, and we will, especially for the children, for the young children who will come with their mothers because they could not be left alone. We tend to have friendly conversation with them, and not for them to be scared about people donning, the full PPEs.
They can be quite intimidating.
So we really needed to quiet them down. So that's what involved pre-testing counseling. And then while it was rolling, we realized that the healthcare workers were getting burnout, and they were having their own psychological issues. So we started intensifying the mental health need back to them before the mass testing for the community started rolling out. So the services, we will try to talk to these healthcare workers. Some of them had their own anxiety, which were coming about, which were leading to depression. Which they had their own family to think about. Some people in their family, if the healthcare workers were found out to be working in those quarantine center or isolation center, they were facing stigma themselves back at home.
Yet they're the actual heroes.
They're the actual heroes.
Crazy.
So we needed to deal with them. We needed to make sure that they're protected.
Yeah, no one ever really thinks of them. Everyone thinks you should be strong for everybody else.
Exactly. So that's how the programs came to expound and really fall, because it was all about the need and what actually needed to be there on the ground. So when we started rolling community mass testing, that's when now we had to venture down to the group, because the same thing that these people were facing in the isolation center and in the quarantine center, it's the same thing that the community were facing them. We had to go down to the ground to sensitize people on COVID-19, and then to sensitize people in terms of the testing and what is required of them, and then to sensitize people to reduce the stigma. Because these people in the quarantine center needed to go back after 14 days. And mind you, as I told you, we used to go with our cards inside there. These cards were branded, they were printed. So we had to talk to the community with the help of a community health extension worker, community health volunteer, and some of the members of the community health committee in those various communities. With those help, we go door to door, we talk to them, we sensitize them about COVID, and we ask them that the people who are coming, that they're no longer infectious, that they need to have the community support, they need to be to maintain their IC.
How strenuous was that, and what was the reaction? Not everyone is that welcoming, because oh, you're the guys with COVID who are telling people not to have COVID. I don't go to my house.
You get
how easy was that?
Sometimes you get to be overstretched. So you find that with the mental health workers, professionals, we were very few. So while others were getting 1 week on and 1 week off, some of us never got that opportunity. Okay, 1 week off, 1 week on. And lucky enough, because it's not really an emergency case, we will not work in the evening. But in situations like TUM, you find that they had two psychologists in there. So they will make their own shift because they had to work in the evening or road. But then you find that with psychological services, where they are offered, it's not the whole day that I'm required maybe to be stagnant. So I will just, for someone like me, I will just arrange my timetable in a way that maybe I will start with the quarantine session, because we never had an isolation center in Likoni. Everybody else was sent to this other side. So we'll start maybe the quarantine center, find the people who were brought overnight, the people who were there, talk to them, if they've got enough food. Sometimes they will have trouble with the food, they will react with them.
Yeah, that actually is a problem. We don't realize there's these very small things that then cause a very huge thing.
Exactly.
Yeah.
They make them
It's not just about having COVID.
Yes, it's about having or not having, because the people who were taken to the quarantine center, you know, that there were contacts of the people. So it wasn't about, they will think about their loved one who were in the isolation center. If they hear any news, they will think about themselves, but also they needed for them to be comfortable, because some of them, they were taken even they are not prepared. Some of them, they had run away. So I remember that time we used to send their numbers into the National Intelligence Services, and we go with the police. So whenever they were, we just take them as they were, you know. And then they brought up into the quarantine session. So that's where I came in. Try to talk to them, so most of them were very angry coming in. So once every day, it was an everyday thing, so long as they were members of the community in the quarantine session, then I had to go through all of them, be it in a group session or one-on-one, and then talk to them, get their fears, are they comfortable enough, trying to handle what I can, and the rest will go to the management. Everybody had their role to play, and then make sure that all the ICP measures were followed. We had all the washing points. We had all the masks. So some of them had to provide masks to them because they didn't have money to buy the masks. And then I'll go out to the community. So depending on which area, you know, there was some hotspot area even in Likoni. Like, for instance, Timboni Ward. So we'll go to Timboni Ward. Timboni Ward was really huge. So we'll go to some location Timboni Ward. Sometimes we get the megaphone, sometimes we get one by one. We keep the social distance, we get people around. We ask people to come out. Some people will just lock their doors. Some people like, Nini watu wa COVID, tokeni hapa, we don't want to hear. So you get a lot of that. You get people who will stand there. They will listen, but they don't want to accept that message, and they will still treat people the same. So yes, it was really strenuous, but you had to push through, and eventually they paid. Especially when we now saw the curve coming down before the curve coming up again around September and November, especially healthcare workers.
So from the conversations and the experience and interacting with people in that state, what would you say were the most common fears they expressed?
The very first thing that they had was the fear of unknown. Again, with the lack of knowledge. Until now, the people who do not have proper knowledge of what COVID is, if you get, they tell you, yes, I'm positive. What if I get to be positive? Will I die? That was the first thing that people were having. That it's a death sentence. Once I'm having COVID and people are falling down in China, we've seen them, and anything else, so we're just going to die. That was the very first thing that we were supposed to have. The other thing we're supposed to have is how they're going to handle the daily activities, especially their basic needs. Food, most of people were living on rental areas, so how they're going to pay for the rent that they were supposed to be due, and then how they're going to basically survive there onwards. Because when the county government rolled out the food program for the poor, it never reached every household. There are some other households which people never really get it. So they were really concerned. You know, people who you even saw in the news were boiling stones for their children. So those were the very, very much fear and concerns that were there to begin with. And then after that, there were concerns now for the children. You know, they're like, watoto wetu wanaenda huko bichi, you know, in Likoni. We don't know, God knows what they're going to do there. They're being molested. So when are the schools going to be open? My kids have forgotten about their plans to schools. So that was another concern, another fear. And this is just a manifestation, as I was talking about, of what really psychological problems that they were underlying. Most people, they will tell you basically that's what was happening, but they were having other issues which were there. But so basically those were the fears that we were anticipating.
So I think as an effect of COVID, not necessarily direct, just from hearing things or seeing things on TV, and the fact that people are losing their jobs and they're being asked to leave the houses. How then do we manage to overcome that anxiety, like from losing our jobs, being asked to vacate houses? How then do we handle that anxiety?
Before I answer that, I've forgotten, when the second wave came about, it really hit the healthcare workers by large numbers. We've got a lot of doctors, a lot of nurses who were dying. So there was just that fear. Like, it really hit the healthcare workers more than it's supposed to be. So there was actually people dying. Now, how do you handle that? With any anxiety, the first thing you need to handle is to have the information, the correct information to handle it.
Not just any myth.
Not just myth, the correct information. You see, once you're equipped, once you know what this thing is all about, then there's that sense of relief that you're going to get, because then you find there are ways of preventing it.
And you're more confident,
You're more confident in how you're going to do that. So the very first thing that we used to do, and we still do right now, is to give the COVID-19 messages. We don't get tired of giving COVID-19 messages, especially the new changes which are rolling out. As I tell you, people used to stay for as long as they're supposed to stay in hospital, to people staying 14 days, and now people are staying 10 days. And to people needing to have 2 tests done, to know people just 1 test done, and they're moving across that they're supposed to be. So that is the very first thing that we usually do. The second thing that people need to do, they need to, and this is just the laying that things back at home, you need to have very strong faith. It's very.
So what happens if you're pagan?
No, the faith is not necessarily religious. This faith is believing that things are going to get better. That is the faith which I'm talking about. You can draw it from religion, you can draw it from whatever it is, but you need to have the belief that it's not somehow things are going to work out.
You can't just give up.
Yes. Then the next thing, which is very important, is acceptance. Because with just like any other loss, when you lose your job, when you lose your house, you go through the process of grief. And the process of grief have got their own stages. So we usually help people to go through those stages, or to at least be aware of those stages. So depending on the social support this person has.
Awareness is really important, because most of us don't realize it's just a stage, and we're going to get over it, and we don't know how to treat our partners and our children.
Yes. So we usually try as much as possible for these people to accept the situation and then change their lifestyle. Because then...
to suit the new situation.
You find the people who were kicked out of their houses, maybe they were staying in a 3-bedroom or 2-bedroom house.
Comfort.
But they can get money and stay in a 1-bedroom or single room. Some people who have the opportunity back at home, maybe they build something back at home, they will send the children back at home, even their partners back at home, or even relocate back at home. And we will encourage those people to get tested so that they can get the certificate to go across those checkpoints at that time. So right now, that's what we usually tell them. Look at what changes that you need to make around your place so that you're going to change. And lastly, we usually encourage these people to find alternative way of relieving stress. These include things like meditation, exercises, an alternative way of saving or making money. And so we ask them to identify the resources that they have within the environment so that they're going to help them.
I think also as a result of COVID and like the lockdowns and businesses shutting down, losing our jobs, we now have to rethink our game plan. Maybe if you had like a 5-year game plan, you have now to extend to the next 10 years. What does it mean for our lives? Have we lost like a whole year? Do we have to fix that somewhere? Can we take it back? Or do we have to like get comfortable with the idea that that's done and we have to like move on?
I cannot really predict those things. There are people whom their life never really changed.
True.
You've got the COVID related.
Exactly.
Who even got richer. You've got people who literally got richer. We've got
fortunately for them.
Yes, fortunately for them, especially the people who are working with the tech businesses. And then we've got people who took advantage of COVID and they were selling things at an exorbitant prices. You've got services which were not really necessarily affected. So there are people who their life may not necessarily change. That something is for sure, depending on also the choices that they're going to make continuing afterwards. And then the people whom their life have changed, they need to rethink everything to begin with from A to Z. Especially we talk about teachers in private schools, those who have gone back. You know, schools are just starting to open and they're looking to have those the monies to be paid. You know, parents who are taking the children to private schools, they cannot do so, you know, and they cannot pay the school fees all at once. There's some schools which were closed because they could not meet the standard or laid by the public health department. So there is a need for all of us to rethink, and I mean all of us, even for those people who got lucky, in terms of how we are saving our money, in terms of our saving plan, and in terms of our lifestyle. Because now we find that everything in our life has changed. We have to take better care of ourselves, because then there is a need to realize that, by the way, I need to take care of myself just in case of another thing happening and I cannot access the medical services. You know, the people who had cancer or diabetes, they cannot access medical services. So you need to be very protective. You need to protect yourself, wear the mask that they're supposed to be wearing. At the same time, there are financial services. SACCOs really did well for those of us, the people who took out loans at a cheaper rate than those who could not service their loans. So before you take that loan out, do you really need to take that loan? You need to ask. Yes, do you?
Do you?
You need to ask yourself. And then, even for those people, as I said, who are rich, because now things are slowly getting back to normal, but then the inflation is at all-time high. Then how are you going to spend your money? So there is a need for all of us to really think of our game plan.
So social distancing, despite the laxity we've witnessed, especially here in Mombasa, where people have forgotten about social distancing and wearing masks. So what happens when your family member or partner or someone who's close to you, who grounds you? You know, Africans, we depend on our families for a lot of emotional support. So what happens then, or how should we act when we are forcefully separated from the people who ground us?
First, you need to understand at the moment, most of the isolation centers and the quarantine centers are closed. So what is happening right now, there is a rollout of home-based isolation and care treatment program that we try as much as possible for the people who are not of a critical care to be self-isolating or self-quarantining at home, and they get care from home. And only those people who really need those services, that they're going to be in those isolation centers, and which are mostly at the hospitals. And there was a time where the isolation centers at the hospitals, all the beds were full. Yes. So we really, really are very cautious about that. So we realize that we don't nowadays forcefully move people from their homes, especially those who are social support to others. But we have implemented those programs so that they are able to be isolated at home and to be next to their next of kin, to see their family, so that they're able to recover quickly. Again, not everybody can qualify for it, because then their guidelines and rules are there. For family members need to have separate bedrooms for people who test positive, which they don't interact with others, separate toilets, so not everybody gets to reach that. And as such, you realize that there's a need to have quarantine centers, which are being worked through by the county government, but nowadays everybody is generally at home. So we ask them, you know you're positive, it's your responsibility to take care of your family members. So we insist on having the masks, especially the surgical masks, and we insist for them to have, even at home, that social distancing. And it works, because then people who are tested positive, most of them comes with symptoms. And they usually take those measures to protect their family members.
How then do we, as family members or partners or children, how best should we help the distressed victim or the person who has COVID?
So social distancing does not necessarily mean isolation, or isolation, it means the physical isolation, but they are usually there. So you can talk to them around the home, engage them, and sort of have family dinners. You don't necessarily separate them, but then you also get to address their fears. We usually train them in basic psychological needs. Not necessarily train them, but we give them psychoeducation, that is the correct word. What to see, what not to see, so that they're able to refer, to give us a call whenever matters arises. But just being there for them, listening to them, and do not be quick to interject them once they're talking. Have empathy whatever they're having, but you realize for them they will have sympathy, not necessarily empathy. But it's okay. But actually have a listening ear and just addressing whatever they have to address. And if they cannot address, especially the psychological problem, then they sort out our help. We usually have the toll-free numbers, we have our own personal numbers on the ground where they can call for the services.
How is there hope? Is there really hope, or should you just make peace with the fact that COVID is here today and it's indispensable, and we just, have to embrace it?
With the vaccine,
how do you stay positive actually? Because everything is falling apart.
With the vaccine, came with a little bit of hope, even though it is marred with a lot of myth. Then the government has really tried to come in with different programs and really help people. And there's also another program which is going to give people money, which the government still want to continue with it, and also Kazi kwa Vijana. So those are the things which will help us stay positive. And one thing which I loved about Kenyans in the pandemic is that they came together. All of us. Again, for you to stay positive is you don't have any other choice to do. Because if you stay negative and things are not changing anytime soon, then what is it that you're telling yourself? So there's a need for you to stay positive. So we wait and see, because again, this disease keeps on and changing its pattern, and really keeps on changing its pattern. But for now, there is hope. It may not necessarily go away, but there is a need for us to learn to live with it and to learn to protect ourselves. And these measures which are there, they are for the betterment of us. Yes.
I think this is a discussion that had to take place because we don't openly talk about mental health issues, and as Africans we haven't yet accepted that they exist, and we can't quite pinpoint what exactly is going on. So this is very insightful, and we want to thank you for availing yourself to come and give us the brilliant points on how to support others and be ready to, take care of ourselves, and many more that you have been able to deliver. I have been your host, Sharon Wangui. Remember, this program is brought to you by Search for Common Ground Kenya and funded by the European Union. Pamoja dhidi ya Corona.